Meet Luis, 54. He counted carbs, walked after dinner, did everything right, but his mornings were still a battle. Low energy, stubborn fasting numbers, and brain fog at work. At his check-in, the nurse practitioner asked a question nobody had asked before. Have you checked your vitamin status? Within a few weeks of focusing on key vitamins and minerals, mostly from food and a couple of clinician-guided supplements, Luis's fasting numbers steadied, afternoon crashes faded, and he felt like himself again. If you live with diabetes, you already know about diet and exercise. But here's the part many people miss. Specific vitamins and minerals can support insulin action, decrease inflammation, and protect your nerves, eyes, heart, and kidneys. Today we'll cover the top 7 vitamins and minerals every person with diabetes should know, with simple food sources, signs you might be low, and when to talk to your clinician about supplements. Stay to the end for a 1-minute daily routine that makes this effortless. 1. Vitamin D. Vitamin D supports pancreatic beta cells, improves insulin sensitivity, and helps calm chronic inflammation. Low D is common. Extra body fat can trap it. Kidney issues can impair activation, and limited sunlight reduces production. What to eat and do. Fatty fish, salmon, mackerel, sardines, trout, egg yolks, UV-exposed mushrooms. Brief, mid-morning sun when appropriate. Fortified options, unsweetened milk/plant milks, yogurt. Avoid relying on fruit juices for fortification, sugar spikes. Supplement tip. Many adults need D3. Common maintenance ranges discussed are approximately 1,000 to 4,000 international units per day, but the right dose depends on your lab value and meds. Get tested, then personalize with your clinician. Daily habit. Plan fish 2 to 3 times per week and pair morning meds with D3 if prescribed. 2. Vitamin B. 1. Thiamine. Thiamine is crucial for turning glucose into energy and for healthy nerves and heart. High blood sugars can increase thiamine loss in urine, and gut absorption may be reduced, leaving you tired, foggy, and more prone to neuropathy symptoms. What to eat. Whole grains, oats, brown rice, quinoa, legumes, beans, lentils, nuts, seeds, sunflower seeds, almonds, leafy greens, eggs, lean pork. Balance plates to avoid spikes. Add protein and veggies to each meal. Supplement tip. Clinicians often use approximately 10 to 100 milligrams per day when deficiency is suspected. Keep glucose controlled. Better control reduces ongoing thiamine losses. Daily habit. Add a grain plus bean bowl. Warm oats with ground flax and almonds at breakfast, or quinoa plus black beans plus veggies at lunch. 3. Vitamin B12. B12 supports red blood cells, nerves, and cognition. Metformin, a common diabetes med, can lower B12 over time. Low B12 can worsen neuropathy and fatigue and raise homocysteine, not great for blood vessels. What to eat? Fish, poultry, lean meat, eggs, dairy, yogurt, cheese. If vegetarian/vegan, fortified plant milks, nutritional yeast, then confirm with labs. Supplement tip. If low, especially on metformin, your clinician may recommend oral B12 or periodic injections depending on levels and symptoms. Daily habit. Build a protein-forward breakfast. Eggs plus cottage cheese plus tomatoes or Greek yogurt parfait with chia and walnuts. 4. Vitamin C. Vitamin C is a key antioxidant for immune function, collagen/wound healing, and vascular health. High glucose competes with vitamin C for cellular entry. Oxidative stress uses it up faster. What to eat? Citrus, oranges, grapefruit. Check med interactions for grapefruit. Berries, kiwi, bell peppers, broccoli, cabbage. Choose whole fruit over juice to keep fiber and avoid rapid spikes. Supplement tip. Food first. If you're low, your clinician may suggest a modest daily supplement. Keep sugars steady so vitamin C can do its job. Daily habit. Add 1 cup mixed berries to breakfast or snack with sliced bell peppers plus hummus. 5. Vitamin E. Vitamin E helps protect nerves, eyes, skin, and blood vessels from oxidative damage and may support insulin sensitivity. Low E can show up as muscle weakness, vision issues, and neuropathy symptoms, especially when oxidative stress is high. What to eat? Almonds, sunflower seeds, hazelnuts, avocado, spinach, broccoli, extra virgin olive oil. Use raw or low heat. Skip fortified pastries or bars with added sugars. Supplement tip: many aim for food sources first. If supplementing, clinicians often prefer natural vitamin E forms. Dose is individualized. Avoid self-high dosing. Daily habit. Toss 1 to 2 tablespoons sunflower seeds onto salads. Add 1/4 to 1/2 avocado to meals for steady energy. 6. Magnesium. Magnesium is central to insulin action, glucose metabolism, nerve function, and heart rhythm. High blood sugar and some meds increase magnesium loss, and low intake worsens insulin resistance. What to eat? Leafy greens, spinach, chard, kale, legumes, chickpeas, lentils, black beans, nuts, seeds, pumpkin, chia, almonds, whole foods, quinoa, steel-cut oats, avocado, tofu. Supplement tip: if advised, magnesium glycinate or citrate are often well tolerated. Commonly discussed totals approximately 200 to 400 milligrams per day elemental magnesium. Too much can cause GI upset. Personalize with your clinician. Daily habit. Build a green plus bean side daily. Sautéed spinach with garlic plus black beans plus olive oil plus lemon. 7. Zinc. Zinc aids insulin storage and release, immune defense, wound healing, and antioxidant protection. High glucose can increase zinc losses in urine. Low zinc can worsen insulin resistance, slow healing, and increase infection risk. What to eat? Lean meats and poultry, seafood, oysters, crab, shrimp, beans, nuts, seeds, whole grains, dairy. Keep portions balanced to avoid big carb loads. Supplement tip. Typical supplemental ranges discussed are approximately 15 to 30 milligrams per day, but long-term high dosing can deplete copper. Use only with clinician guidance. Daily habit. Add beans plus pumpkin seeds to salads or bowls. Rotate seafood once or twice weekly. 8. 1-minute daily routine. Easy wins. Morning. If prescribed, D3 plus B12, especially on metformin. Breakfast equals 20 to 30 grams of protein, plus fiber, berries/chia, plus healthy fat, nuts/avocado. Lunch, green plus bean bowl, leafy greens, legumes, veggies, seeds, olive oil, lemon. Dinner, fatty fish 2 to 3 times per week or lean protein plus 2 veggie sides, 1 leafy, 1 colorful. Snacks, almonds/walnuts, small handful, cottage cheese plus cucumber, apple plus peanut butter. Hydration and spice, water, unsweetened tea, coffee, flavor with cinnamon, herbs, citrus zest, skip added sugars. Checkups. Ask your clinician about vitamin D, B12, magnesium, and zinc labs at your next visit. Conclusion. Diet and movement lay the foundation, but vitamin D, B1, B12, Ce, magnesium, and zinc help your body use that foundation. Better insulin action, fewer spikes, stronger nerves and vessels, and faster healing. Start with food, identify any gaps with your healthcare provider, and add targeted supplements only when needed. Stack these habits for a steadier A1C and steadier days. If this helped, please like, subscribe, and comment which nutrient you'll focus on this week. Your story might be the nudge someone else needs.